All right, today we're going to talk about pain and tissue damage. So this is an interesting topic because I think for so many of us, we think pain equals something is ripping apart or something really bad. And what we need to appreciate is that pain is a signal. And yes, sometimes when we apply stress and too much stress to a body part, we get a pain signal. But that doesn't mean, especially as we have this pain that's been going on for a long time, that if I feel a symptom that I am doing more damage. And I think that is one of the biggest and strongest conversations that we have with our patients to help them understand this process, especially if you've had pain for a long time, or some people are just really fearful of any kind of pain signal that they really believe that they must be doing something to be causing more damage. Our tissues are incredibly resilient. Way more than you'd think, way more than I thought even in the early part of my career. But the reality is our tissues are pretty tough to do damage to, especially with some of these everyday tasks. Now, that doesn't mean that since pain is a signal that I can't do something or you can't do something to increase that signal for a short duration of time. But that even if you feel that signal doesn't mean that, again, you've done actual physical tissue damage at that moment. It's very, very important to think about this. Especially we see it with our back patients. So let's say somebody has a herniated disc and have the MRI to prove it, and they're doing really well, and then one day it's sore for some reason. 3-6 months later, and they're kind of like, oh no, did I re-herniate my disc? It's chances are, even if you had an MRI, the first one, and then you took another one that day, they may not look really any different. They might even look better the second time, even though you've had this flare-up. And that's okay. What we've learned is that it used to be that somebody comes in with pain, they get an MRI or they get some imaging, and they find something and they go, that's the problem, I see it, I got it. And then people started taking MRIs of people that had zero symptoms and started finding all kinds of stuff that is considered pathological or diagnosable. And again, they had zero symptoms. So what that tells us is that just the findings on an MRI alone aren't enough to be one-to-one correlative with your symptoms or your pain, or even what you think is going on to be in all reality. So what does that mean? That means that there's a lot more to this process. And again, even if you have an MRI that looks awful, I've seen people that have awful looking MRIs that are doing really, really well. And I've seen people that have teeny tiny little, when they use small words like mild, minimum, kind of based findings, but they have lots of pain and dysfunction. So again, it's not a one-to-one. It's not a direct correlation. It doesn't always match up that way. And that's fine. A lot of that is how our body's wired. A lot of that is just how our body is able to heal, the levels of inflammation, and what else our bodies can kind of buffer physically and mentally. So just something to think about. Again, it's our job to guide you through that process and help you best understand what phase you're going through and have these conversations so that we can all kind of stay on the right path, teach your body how to get stronger, how to get your body into a place where it can do its job and heal the best and get you back doing all the things you want to do. Sound good?